I'm having a particularly bad day with tremors, it's difficult to do basic stuff like, you know, validate a check, or, you know, I'll do freelance journalism sometimes when I'm okay to work, and like holding a camera can be like a nightmare. Embarrassing, super embarrassing, because people associate tremor with older individuals. So when you have it, and it embarrasses people to see you having it. Like it throws them off, and it just throws you off even worse. So yeah, shame is something I kind of struggle with a lot. As far as what brings the tremor on, I mean, it varies. The worst is that sometimes nothing will bring the tremor on. It'll just happen. And that's the worst, because if you can't pinpoint anything, there's nothing you can tell yourself. Well, just don't do that next time.
Functional tremor means that the patient has a tremor that is caused by a functional etiology. Just imagine that the brain is a computer. You may have either a problem with the hardware, meaning that something is broken in the computer itself, or you may have a problem with the software. So in functional tremor, the brain, the neurons, everything is fine. So the hardware is okay. It's a problem with the software. So there is some malfunctioning in the circuitries of the brain, and this is why we call it functional, and this is why, in theory, a person with a functional disorder potentially can become disease-free. But this doesn't mean that these patients don't have a disease. These people suffer exactly like all the others. They are not making this up. It's not malingering. Malingering is a very well-known condition where the patient on purpose mimics a condition. For instance, when you want to have reimbursement from insurance, or you don't want to work, this kind of thing. There are researchers thinking today that this is somehow related to post-traumatic stress disorder, and it can be the consequence of an old trauma. Sometimes in the history of people with functional disorders, there is an history of sexual abuse, of physical abuse during childhood. In some other cases, there is no problem, no history of any trauma whatsoever, and this is why it's very difficult to claim that these people have psychiatric problems. Now, the problem we have is that many doctors are not comfortable in making diagnosis of functional disorders for many reasons. Partially because there's still a sort of misunderstanding in the community that if you have a functional disorders, this means that you have a psychiatric problem, and as you know, with psychiatric problems, there are a lot of other connotations, you know, the stigma that the society unfortunately has for these conditions. So many doctors are not familiar with the right process to diagnose these cases, and even when they are still reluctant in formulating the diagnosis. And this is very wrong for two main reasons. First, because these patients are left without a diagnosis, going around looking for an answer, and some of them end up having brain surgery or very invasive treatments. So I used to say I'm the final step between the patient and the neurosurgeon. And if I miss a diagnosis of functional tremor, this patient will end up having surgery for no reason. And we know that if you do brain surgery in someone with functional tremor, there is no improvement of the tremor. All functional disorders can be reversible in theory, but sometimes, especially when the time between the onset of symptoms and the final diagnosis is too long, it's very difficult to go back for a number of reasons, particularly because a patient gets used to some extent to the new condition. It's known that if the patient understands the diagnosis and agrees on the diagnosis, the outcome is much better. In his case, the outcome, I would say, is very good, because when I met him for the first time, he was seriously impaired by the tremor. He could not work anymore, and with the right diagnosis, explaining him what the problem was, and he understood this very clearly, he got better in a couple of minutes. It was quite fast, and this is not the first time that I see such a thing. In some cases, instead, it's more difficult. Diagnosing the patient on its own can be a treatment. The other one will be psychotherapy. There are people using hypnosis. Another resource that we use quite often is physiotherapy.
I don't know that I see them ever going away, but certainly I see it being something I can manage more easily and like build a life around, and that's been really great.